Hey guys, so I tend to always say the most important person in the room is you. What I mean by that is that if you are not looking after yourself, how can you really look after someone else? How can you give best practice if you're knackered, fatigued, exhausted, disillusioned, depressed, if you're burnt out? Now, this is a bit of a shout out mainly to students and new graduates, because you guys, when we look at the research, tend to be most at risk of burnout, especially within physiotherapy, physical therapy, or manual therapy in general. How can we try to reduce burnout? There's a few things that I've highlighted in the text below and links to the research as well. So things that I think are pretty good coping strategies. So number one for me is about understanding your workload. I think for me, learning to say no is an important tool. If you don't learn to say no, you are going to be inundated with work, people wanting you to do stuff, people just chucking stuff on your plate, doing too much, taking on too much is just going to be a downward spiral of feeling overwhelmed, and that can lead to subsequent problems. So learn to say no, take control of your work. Do what you need to, and if you have time, do more. But if you don't, learn to say no. Have good relationships with your colleagues. As much as I hate him, my business partner, Jimmy Michael, is a great guy to talk to. When I feel stressed, when I feel exhausted, when I feel disillusioned, when I feel overwhelmed, I pick the phone up and we have a chat and we can talk about it. We can have a chat. I can offload. Having a good relationship with a colleague or a work colleague, someone who's a mentor, can be really, really important. You're not an island. This is the key thing. You have to work together in this profession. If you are an island on your own, it can be very, very challenging. You need a work-life balance. You can't just work. I say this from personal experience. So the first sort of 10 years of my career, I put my head down and I literally didn't take a day off. There are pictures of me from years ago and I am just gaunt, white, exhausted. You can't give best patient care. You can't do your best work if you are absolutely knackered. You have to be fastidious. You have to basically have a good work-life balance. There's loads of videos of me doing silly handstands, but the reason why I do so much training is because it means I can turn my phone off. It means I'm not thinking about work and I can just spend a few hours as often as I can doing my exercise. It's a great work-life balance for me to de-stress. Setting boundaries. Oh my God, guys, you have to set boundaries with your patients. You cannot take on all of their emotional stress, their pain, their problems on top of yours. You are just literally going to explode. Some patients, I refer to them as like emotional vampires. They'll come in and after your treatment session, you feel exhausted and mentally drained. Have a question with yourself. Should you be treating that person? Maybe it's better that you refer them on to someone else. If you see someone's name in your patient list and your face drops because you're thinking, oh my goodness, I just can't face this person, maybe think about referring them to a different healthcare provider, because ultimately you have to look after yourself. And finally, I'm a big fan of learning. So for me, I keep learning. Maybe it's a little bit of imposter syndrome, but I'm a big fan that there's so much to learn. The more you learn, the more confident you feel, the more happy and satisfied you feel, the better care you can give. If I'm ever in a situation in clinic or when I'm teaching or if I'm talking to someone and I come across a point or something that I think, do you know what, I'm not 100% sure about that, great, I'll write it down and then I will literally go and I will read about it and I'll learn about it. You will never lose on education. It will always help you in the long run. So guys, you have to look after yourself. If you are not looking after yourself, how on earth can you look after your patients? Avoid burnout. These are a few little tips for you to think about. 2023, new year, new you. Set goals, set boundaries, and smash your clinical practice. Boom.